Welcome back to Daytime Tri-Cities. I want to remind everyone that Sullivan South High School is dismissing classes in just moments at 10:30 because of a power outage. So if you have a student at Sullivan South High School, they are dismissing classes at 10:30, which is in about 2 minutes. Leukapherisis is a laboratory procedure in which white blood cells are separated from a sample of blood, and those white blood cells can be used for several medical and research purposes. And today, Dr. Tom Rogers from Performance Medicine takes us to a local facility where leukapheresis is performed on a daily basis.
Thanks. We're here on remote location today at Physicians Plasma Alliance with Kevin King, who has expanded his building and facility. I've been sending Kevin patients for years to donate blood, and also for therapeutic reasons and beneficial reasons for the patient and medical research throughout the world. It's amazing that we have this facility here in the Tri-Cities. Kevin, we're going to talk about a new procedure that he's doing here called leukapheresis. What is leukapheresis?
Well, leukapheresis is a procedure, and this is the machine here. It allows us to have patients come in as a donor. We collect white cells. So those white cells are utilized in drug development research, cell line research, and can be frozen, can be fresh after we process it, and that really can go out anywhere all over the world.
So we're talking about white blood cells, not red blood cells, which is kind of a unique method.
Right.
Now, tell me, who's an ideal candidate to come out here and donate?
Well, really, we need healthy people. 18 is the minimum age. They have to be over 18. And we accept patients up to 65. Most of our researchers look for patients between 18 to 50 range. And that's just because the white cells tend to be more robust. But you just have to pass our brief physical, pass blood pressure, pulse, normal hematocrit. We also do a CBC analysis prior to your collection, and if you pass those, then you can be a candidate.
Now, what are the benefits to the patient by coming here and doing this procedure?
So the patient does benefit. We do pay for their time and effort to come out here, and so that's one of the main benefits of the patient. There shouldn't be any ill effects or any problems after the donation. Usually all of our patients do very well with it. It's a very easy procedure. You just have to sit for a few hours during the procedure, but it's very easy.
I sent my nephew out and he was very grateful.
Yeah, great.
He really appreciated that. But so today you're having a kind of almost a grand opening for this thing, and I understand you're going to run free blood work, a hemoglobin A1C, which is a measure of sugar metabolism during the previous 3 months, and also a CBC, which is a white and a red blood cell count. That's a great deal for patients. You know, we do a lot of work with diabetes, and a lot of my patients need that test.
Yeah, and it's, you know, I think everybody's touched in one way or the other with disease. They either have it or have had a family member or friend that has some condition, and, you know, we all want research to happen and hopefully find cures, find new testing, new drugs that will help. And by having this here in the Tri-Cities, we can help promote that.
You know, being passionate about diabetes because of myself having 2 diabetic kids, I really think this is a beneficial place for people to come. And so many patients that I see are diabetic, probably a third of them are already diabetic. So there's a lot. I'm really fascinated about what you're doing here, and I appreciate what you're doing here. It's an amazing thing in the Tri-Cities that we really have this. So I want to encourage everybody to come out, and today you have till 1 o'clock today to come out and get free lab testing. Consider if you're a candidate for this leukapheresis test. Kevin King, Physicians Plasma Alliance, an amazing place. If you have any questions, contact me at performancemedicine.net.